All right, so the title of this session is Advocating for Your Child in the School and the Healthcare System. And the panelists that we have today are Dr. Angela DeBastos, who's a pediatric neuropsychologist at Beaumont Children's Hospital. We also have Tricia Luker. This is actually Calvin Luker, Tricia's husband, who they work together at the Respectability Law Center, and Calvin is a lawyer who specializes in special education advocacy. And then, of course, Cindy Handford, who you may recognize from our previous session. So thank you all for joining us today. So in an ideal world, all schools and healthcare systems would anticipate and promptly meet all of the needs of our children with epilepsy without hesitation. In reality, despite the best efforts of caring and committed professionals, the services children need aren't always provided at an adequate level or in an appropriate time frame. So as a result, parents often need to advocate strongly and persistently for the needs of their child, and they may need to enlist outside help on occasion. So in this session, we're going to focus primarily on school-related advocacy. We'll also touch briefly on advocacy in the healthcare system. We'll talk briefly about medical home models and care coordination in the healthcare system, but the majority of this is going to focus on school advocacy. So in the last session, we talked about managing medical needs in the school. Now we're going to really focus on managing learning and academic needs in the school. Because it is important to realize that advocacy can be involved in the managing medical needs, as we mentioned, but right now we're going to be focusing on those academic needs. So a number of factors can contribute to cognitive difficulties in children with epilepsy. You can have the underlying brain condition that's causing the epilepsy. You can have medication side effects, sleep disorders, interictal epileptiform discharges, which is abnormal electrical activity between seizures, and then also the seizures themselves and the after effects of seizures. All of those can contribute to cognitive difficulties, and it can be difficult for school personnel to recognize that because they may not be familiar with that. Dr. DeBastos, what are some of the most common learning difficulties that people with epilepsy face in the school setting?
Can everybody hear me okay? All right. So I think that it's obviously a somewhat difficult question to answer because every child's different and their epilepsy can be unique and how it affects them is unique. But one of the things that I see almost universally across all of the children that I work with in my office are difficulties with attention and executive functioning. Most of those children would technically meet criteria for diagnosis of ADHD, but it's different. It's very different, and we'll talk about that a little bit later at some point as well. So this is things like the attention's obvious, difficulty concentrating, but things like impulse control, not able to settle down, they make those silly mistakes because they're not paying attention to the details. It also includes emotional control, and that's one of the things that a lot of parents express frustration with, is they'll see their children getting overly frustrated, or they'll hold it together all day at school and then they come home and they just kind of melt down at home. And it's really all related to that executive functioning, so just being able to control their system as they need it. And I think the reason why this is so important is that it can really interfere with the child's ability to show what they can do and what they know. So for example, a child can have average IQ, average academic skills, even average grades, and still be really struggling with those attention and executive functions, and the schools don't always necessarily see it, oftentimes because you as parents are doing so much to help them at home. You're kind of beating their frontal lobes and helping them to have it not be as much of an impact. And so that can also lead to some difficulties with the school understanding that these sorts of things are going on.
Right. And I know in adults that probably the number one complaint, cognitive complaint, is memory function. Is that less of a problem in children, or is it also a problem, or is it sometimes that what seems to be memory problems is actually an attention problem?
I think it's all of those.
Okay.
Yeah, it can be all of those things. So sometimes there is an actual memory problem. A lot of that does depend on where the seizures are coming from. The temporal lobes are involved in our ability to hold on to information over longer periods of time. So if you have seizure activity that's coming from that area, that can impact the ability to retain that information. But oftentimes what parents are really talking about when they come to me with problems with memory is more working or short-term memory. So it's, being able to follow multi-step directions. It's a big source of frustration at home, obviously. You ask them to get their teeth brushed and their shoes on, and you go find them doing something completely different 15 minutes later. And it's very easy to look at those behaviors and say, they just don't want to do it. They're just not trying. Sometimes the schools will see that too. But oftentimes they really can't help it, and they just lost that information along the way. So most of the time, memory in that sense is forgetfulness when parents complain about memory. Sometimes, though, it can be memory retrieval, which is actually also an executive function. So the information might have gotten in, but getting it back out when they need it is hard. And that can be really frustrating for a kid who kind of knows that they know it, but they can't explain it or they can't pull it out on that test when they need it in the moment.
Okay. And what about processing speed? Just the impact of both, again, the underlying condition, but also the anti-seizure medications can kind of slow things down. How common is that, and what are some strategies for dealing with that?
Sure, it really depends. As you all know, there are so many different medications. There's so many different ways that kids can react. One can react one way to it, and another child can react completely differently. But certainly once you're bringing on multiple medications, you definitely can have that impact of slower processing speed. Sometimes it can look like inattention to teachers because the child's just not keeping up with the speed that the class is going. It will take them longer to get through activities, to finish tests, to finish tasks. And oftentimes the accommodation is to just give them extra time. But sometimes the problem with that is that there's only so much time in a day. And so we often need to take the next step of, okay, now we need to really figure out what is the most critical for them to know, and can we cut out some of that work so that they can also be kids. We can't have them just doing 3 or 4 hours of homework when they're 10. And I've seen that, and it just, there are certain things we don't necessarily need to have to do. So.
Right. And one more follow-up question in regards to ADHD. There's a concern among some parents that stimulant medications used for ADHD may increase seizures or would otherwise be contraindicated. Can you talk about whether it's safe to use ADHD medications like stimulants in children with epilepsy?
Sure. So what I would say with that is that your epileptologist or neurologist wouldn't prescribe it for you if they felt like it wasn't safe. I can't personally recall a time where a child was started on stimulant medication and needed to come off because it was increasing their seizures. I think what happens more often is that they don't work. So because the difficulties with attention, impulse control, things like that are being caused by something else that's different than a developmental ADHD, which is more of a chemical difference in how the brain processes information. Sometimes the stimulants or the non-stimulants even don't work as effectively as they do for a child who doesn't have a neurological condition as well. So that's what I hear more frequently than, having started something and having a side effect like that.
Okay, great. So how are learning challenges associated with epilepsy different from those learning challenges associated with other disabilities? And then do standard assessments at schools tend to accurately detect those difficulties in students with epilepsy?
I think that the number one difference is consistency and stability. So as all of you know, living with someone, caring for someone who has epilepsy, it's not a constant state of existence. So you could have a period of months where maybe there aren't any seizures, and then all of a sudden you're in the emergency room, and things are completely different, and all of that's impacting your child's brain's ability to function. And so when you're talking about something like ADHD or dyslexia or other neurological problems, even a traumatic brain injury, those cognitive difficulties tend to stay pretty similar. There's obviously going to be fluctuation. You're going to have good days and bad days, but I think with, in my experience with children with epilepsy, those good days and bad days can really fluctuate a lot. And the reason why I think that's really important is that what I'll sometimes see happening in the schools is that, okay, my child can do this on one day, they come in the next day and they're not doing that skill, and sometimes that gets misattributed as being defiance, or they just didn't study, or they didn't try, and it's really that they just can't access the information, or maybe even they lost it because of the type of epilepsy that they have. Which leads into the answer to your second part of the question. The educational evaluations that are done at the school typically include an IQ test and academic achievement testing. Sometimes they'll look at fine motor skills, but really just from a can they produce legible handwriting kind of standpoint. And they will do language testing if that's a concern. What you may notice, though, is that I didn't say anything about attention, and I didn't say anything about executive functioning, which earlier I said is one of the main things that children with epilepsy struggle with, or one of the things that all of them consistently seem to have difficulty with. So, and memory. So the schools don't test some of those core things that children with epilepsy struggle with. And then again, like we were talking about, they don't necessarily understand why the skills may fluctuate, or why the child can do it on one day and not the other day. So that's where neuropsychology, somebody who understands epilepsy, understands how this all works, can really be a benefit when you're trying to get services or support at school that maybe the standard psychoeducational testing that the school doesn't capture the things that your child's struggling with.
Right. So can you talk a little bit about neuropsychological evaluation and what it involves and how you go about getting it?
Sure. So neuropsychological evaluations in some ways are similar. Some of the tasks that we use are similar to what the school may do. So for example, I always do an IQ test. I always do at least a pre-screener of academics. But as I said before, it also captures those other skills that aren't captured well by school testing. So sustained attention, executive functioning, and memory, and fine motor skills as well. And so what the advantage of the neuropsychological evaluation is anybody can give a test and give you a number for something, but it's understanding how that relates to your child's epilepsy, how that relates to how that shows up for them. So like I said before, sometimes test results won't accurately reflect what's going on in the day-to-day life, or the day-to-day life doesn't really, in the school setting, the difficulties your child's having aren't showing up there. But when you look at their test results on these formal testing, and the neuropsychologist meets with you and talks about what's happening at home, you get that extra piece of the puzzle that can then help the school understand what's happening and provide a different intervention approach. As far as getting neuropsychological evaluations, it really, there's different reasons for doing them. So sometimes it's a medical reason. Your epileptologist or neurologist wants to know, are we seeing improvement in cognition with this treatment? Or are we needing to treat because this child's having more and more trouble with things and they're not responding to medication the way we expect them to? So from that standpoint, your neurologist or epileptologist would be making a referral to a neuropsychologist either within the hospital system that you are seeing them, or to a private practitioner who has experience with epilepsy. The other way to do that, though, is that if your neurologist or epileptologist doesn't initiate that evaluation, going to them and talking to them and saying, we feel like we're missing something. we're seeing these difficulties, it's the school's not getting it, whatever it might be, and then they can make the referral. But they're going to be the best person to send you to someone who knows what they're doing with respect to that.
And how hard is it to get them paid for through insurance typically, and can you ever get them paid through the school system if you have an IEP?
That's a good question. So generally, neuropsychological evaluations when the child has a neurological condition like epilepsy are actually pretty well covered by the insurances. Obviously, you'll have your co-pays and deductibles like you would with anything else, but it goes through the medical side of your insurance. So, for example, if you have an insurance that uses a mental health carve-out, that carve-out isn't involved at all with the payment for the neuropsychological testing. I forgot that you had the second part to that question.
Can the school system ever
yes,
cover that
thank you.
through an IEP?
Sometimes you can request an independent evaluation if you feel like, and you guys will probably be able to speak to that better. If you feel like the school is not is missing something, or that something is being missed in general, and that maybe it's not feasible to obtain that evaluation privately through your insurance, you can request an independent educational evaluation. But I'll leave that to these experts here to talk about.
Have you found that that's something that can happen, that maybe doesn't happen very often, but it could happen?
It could happen. Usually for neuropsychs, you have to request them, and the issue for the police, for the district, is always going to be who's going to pay for it. Typically, neuropsychological evaluations are more expensive, and so I would say it's an item of negotiation. You have a right to request independent evaluations, and we do ask for them frequently. But it seems like it's always a negotiation with the district on whether or not they want to try to impose some kind of limit to it. It usually also ends up being resolved in part by having the insurance that's available to the student cover as much as it can, and then the district will agree to pick up the rest of it.
Okay. One more question about neuropsych evaluations is, we mentioned how you can have good days and bad days. If a child has a scheduled appointment and then the day before they have a seizure, is that going to skew the results, and do you recommend in those situations that you reschedule?
Yeah, it depends. It depends on how frequently their seizures are happening, because to some degree, if that's happening very frequently, then more often than not, that's how they're presenting in other settings too. So it may not reflect what they're capable of doing, but it will reflect the impact of their epilepsy. Certainly, if your child doesn't have seizures very frequently, or they're under fairly good control, and they happen to have a seizure right the night before, then yeah, we probably would want to reschedule, because then it's not going to accurately reflect what they're dealing with on a daily basis.
Right.
Yeah, that's a good question.
All right, so obviously each child is different, but what are some educational interventions and strategies that you found to be particularly helpful for students with epilepsy who have some of these cognitive difficulties that we mentioned?
So I think that honestly the number one thing is having a teacher that's flexible. Now obviously you don't always have control over that. But when you can have control over that works really well. So you want a teacher who's structured, okay? So you don't want, someone who kind of comes in and flies off the seat of their pants every day. But you do want somebody who can be flexible and understanding that there are going to be those good days and bad days. Again, it really does depend on what specifically your child is struggling with. But speaking along the whole attention executive functioning lines, some of the common accommodations are things like extended time, going along with that, compressing the workload like we were talking about earlier. Sometimes you just don't need to have them do every single assignment. If your child has particular difficulty with reading or with pacing themselves, so they tend to go too quickly, sometimes having tests read aloud to them helps. One of the things that
I was going to say, with short-term memory, the reading difficulty is a big issue that they do not recognize, and that can impact testing, the type of testing they do, because as someone who has epilepsy, I mean, and I was on medication that really impacted my short-term memory, and I got off of it. I didn't realize how much it had impacted my ability to memory. You know, you'd read the first sentence 3 times and it wouldn't stick in, and then 4th. And you can imagine that happening with a child.
Yeah, yeah.
Okay, so no accommodation. So it has to change the type of testing pattern. It has to change, rather than book reading and things like that, another way of impacting their ability to get that information in other than that, because the short-term memory deficit is a real problem.
Yeah, and I found that technology really helps, and so part of the neuropsychological evaluation actually can help to tease apart, you know, does your child understand and remember material better when they read it versus listening to it, and then that's going to lend itself to which accommodation is going to be most appropriate. So, for example, I see a lot of kids who have a harder time concentrating with reading, in part because there's just more things the brain has to do while reading versus listening to something, and so having access to audiobooks where they can listen to their science and social studies material instead of reading it can make a huge difference. There are some really awesome apps that are free that I recommend all the time that provide that same kind of thing and you can convert pretty much anything into an audio format. So Natural Reader is one of my favorites. It's available for Android and Apple. And you can download that onto a phone, computer, and it will read text aloud to you. And then there's also DocuScan, which was actually shared with me by another patient who had used it, and it allows you to take photographs of paper versions of things, and then you can use the Natural Reader to audio, you know, to read it aloud to you. So it's integrating that technology can be really helpful. The one thing I was also going to mention that I think can help with the attention and with the working memory, it obviously depends on, you know, your child's ability to cooperate with this concept, but previewing material when you can be really helpful. So there's a website that I really like. It's called Khan Academy, and some of the schools use it anyways, but it can be really helpful as a way to not just review material that's been presented already, but to look at it ahead of time. So if your child if you know they're going to be learning about this complicated topic tomorrow in school, have them watch a video on it the night before, which is what Khan Academy is all instructional videos on different concepts. So when they're sitting in the classroom and there's 30 other kids and the teacher's going on really fast and they may not be able to focus as well, it might help them to focus better because they already are familiar with the material. It's not brand new to them. So I recommend that all the time. It's not always easy to do and manage with all the other work you have to do for homework and stuff, but that's one of the accommodations I feel that can be really helpful.
And that's K-A-H-N or K-H-A-N?
It's K-H-A-N.
Okay.
Academy, yeah.
I was going to say organizational difficulties is a big
Yes,
issue. Okay, so the daily planner that they have, you know, that's a typical accommodation. But I've talked to them about if a kid has a memory issue, he's not going to remember to take that planner. He's not going to remember to put things in that planner. He's not going to remember what he put in that planner and what it would relate it to. So a lot of times all you have to have, and schools don't like this, is having the teacher be responsible for checking. Mm-hmm. And they have to understand the reason why. It's not apathy. It's a side effect of the medication. It's a complication of their disorder itself. Mm-hmm. So educating them on that and possibly giving that motivation and empathy to realize that, you know, it's not, you know, you're not being easy on the child. The child has this definite physical issue that requires this type of accommodation.
I like to think of it as you're leveling the playing field when you give these accommodations. You're not giving them some sort of advantage. You're helping them to be able to meet their potential because they have these specific things that aren't functioning as well. Along those lines, thank you for bringing that up because that reminds me, I often will also recommend having the child be allowed to use a cell phone. It doesn't even have to be an activated one. It can just be one that has a camera on it that doesn't have any other function, right? So it's not a distraction. But they can use that to take pictures of what the teacher has put on the board for homework instead of having to write it down. It's quick. They have, you know, they're more likely, not always, to have their phone with them versus keeping track of the planner. And then the other thing is that if you have issues with bringing stuff back, so I hear this all the time, we spent hours on this assignment and then they didn't turn it in. sometimes you can get the teachers to agree to let you scan and email those assignments as soon as they're finished the night before and get those sent to the teacher. So you know, even if a teacher wants a backup, wants the hard copy in the classroom, you have a backup for it so it doesn't get lost and they don't lose all of this hard work they put in. So those are very easy accommodations that can be
Yeah, and you still might get some resistance,
Yeah,
but
absolutely,
explaining
yeah.
to them that, you know, it's easier for them in the long run, rather than struggling, you know, trying to figure out what accommodation works for this child, and we have these already.
Right.
You know, and that's the big issue, is changing their type of teaching system. Teachers are pretty organized people, sometimes they don't like to have that system broke into.
Yes.
But that's what's called individualized.
Right.
And Calvin, did you have any other strategies that you've encountered that have worked really well in the past that you wanted to share?
Well, it's been, I guess just generically, it's been our experience that issues that relate to children with disabilities generally and kids with epilepsy break into three pieces. It's a medically related issue, it's a behaviorally related issue, or it's an academically related issue. And you, Angela and Cindy have both, we've already had examples of all three of those. And Cindy's last comment was, I think, the most appropriate. What we're talking about here is individualized. You really need to you really need to make sure that to the best of your ability you understand your child's needs and have the support that you need from the outside professionals to help you essentially educate the school district to what they need. One of the things that I wrote down is, you know, you don't know what you don't know. And for a lot of teachers who already are under tremendous pressure because they have more students than they can handle, and we're all, of course, advocates for complete inclusion, which means that kids with disabilities are included and educated with their same age peers. That puts a lot of pressure on the teachers, and the teachers don't necessarily even know what to think about when it comes to what your child's specific needs are. Like, for example, what your child's seizures look like. If your child has absence seizures in the classroom, the teachers ask your child to answer a question, and your child is just sitting there blankly, the teacher could mistake the reaction as one of defiance and suddenly deal with it on a behavior basis. If you're not going to answer my question, then why don't you go down to the principal's office? You know, there's any number of ways that people who don't have all the facts, because they don't necessarily have the time to have all the facts, react inappropriately to what they're seeing from the student. And so it becomes our responsibility as parents to be sure that whoever has contact with our kid at school understands what our child's seizures look like, when is our child communicating non-verbally as opposed to acting out or being misbehaving, how does our child process things academically, which is really important. Our daughter Jessica, her processing time was significantly delayed. So you might ask her a question and she may look like she didn't hear you ask the question, and then maybe 10, 15 seconds later, she gives you the answer. If you ask her more than once in that time period, of course, she becomes frustrated. I'm still doing this, you know, give me a chance to finish. Teachers and school officials can have the same types of reactions. So it's very important in the context of what your child's academic, medical, and behavioral needs look like that the teacher understands that. And in that sense, the first thing that I like to suggest to parents is that as you go down this road with the school districts and with the teachers, you really have to decide whether or not you're going to try to create a relationship with the teachers in the school that deals with negotiation and partnership, or if what you're going to try to create is an adversarial relationship. You didn't do this, so I'm going to do this in response on behalf of my child, and take essentially, anybody can ask for an independent educational evaluation, which is what we're talking about with the neuropsych report. But when you ask for it, as Cindy was pointing out, the school district is going to look at it as an issue of economics. They're going to look at it as an issue of what's the point, and then they're going to maybe be resistant. If they understand that what we're looking for is, we don't think that Janie is processing things very often, and we're finding that her level of absence seizures is increasing at home, and we want to be sure that you know this. It creates more of a situation where you feel like you're working together, and gives everybody the chance to look at what the child, who the child is and what their issues are. So those are, I guess, those are initial thoughts.
Great. So can you briefly talk, Calvin, about the differences between a 504 plan and an IEP? We mentioned those terms earlier, and some people may be familiar with them, some may not, but can you just kind of give a real quick overview of the differences?
Sure. Actually, there's three structures that school districts will use to address issues for kids who have disabilities. The first one, the Individuals with Disabilities Education Act, is a federal law that first came into existence in 1975. When we talk about special education law and IEPs, we're really talking about the Individuals with Disabilities Education Act. What it does is it requires school districts to provide all children with a free and appropriate public education. It has a lot of requirements in there for the school district to follow, to identify and to appropriately address kids' challenges related to their disabilities. It also has a structure that parents can use in an effort to resolve disputes. The Act, like I said, the Act is highly structured. It has now been around for 42 years, and so over the course of this time, it's been interpreted so many times that we have a real good idea of what should happen in a given case if you actually end up into an adversarial relationship. Section 504 is a federal law that's been around since 1973. It's called the Rehab Act of 1973. What that law says is that for any entity that receives federal funds, they must accommodate people with disabilities in the provision of services. What that means is that if you're a person with a disability that impacts a major life function, and in the school setting, more often than not, that's learning is one of the major life activities that will be impaired by the student's disability. What the 504 does is it, through a slightly more informal process, gives school districts and parents the opportunity to sit down and discuss and put together plans, but those plans don't have all the teeth to them that would exist through the special education law. And districts are able basically to come up with their own mechanism to test whether or not the 504 plan that would be created is being followed, and whether the child is actually getting what she or he needs. The third is I like to think of it as the We Do That program. And what that is that you have a child with disabilities, and your child's in the class, and you want things like more time, or sit close to the front, or repeat instructions, or other things that might relate to primarily the academic issues that the child is facing as a result of their epilepsy and other co-disabilities. And the district will say, well, that's in our classroom plan. We do that for all students. We give all students extra time if they need it. We give all students, we'll read it twice, all they have to do is raise their hand. But what they'll do is basically they'll say, we don't have to create a plan for this for Jimmy because we already have it in the classroom plan and the teacher does it with everybody. We don't typically like to accept that as a reason, so we will insist on a 504 or an IEP. But that's the third way that school districts try to address issues.
Right.
So those are just kind of nutshells.
Sure. So in planning a student's IEP, who should be involved, and then what are some of the key components that should be included in an IEP? And then just if you can kind of speak also briefly to what contributes to a successful process, IEP planning process.
Well, to answer the last first, I think that I think the most important thing is creating and maintaining a positive attitude between the members of the IEP team or the members of the 504 team. In each instance, parents are full members of an IEP team, they're full members of a 504 team. And so you guys should be included in everything that happens with your kid, which is to say, if there's behavior challenges and they want to do what's called a functional behavior assessment, you're a member of the IEP team, you should be at the table when they talk about what the issue is, when they talk about what your child needs. And this is something, I mean, that's a core discussion. Anything that's a core discussion about how to address identified needs from your child, that's a process that you parents should be in. So that's number one, is that partnership is important, and it's important that you be included as a full team member in that process. The second thing that I think
I was going to say, Calvin, to be a full member of that process too, you have to do some education for yourself. And Michigan Alliance for Families has some great webinars on that, on their website to listen to about what a 504 is, what an IEP is, the process, the deadlines, also the acronyms that they use, getting used to the forms that they use, so you know the lingo that they speak in, because the meeting is not the time to educate you in that process. You come in there prepped and ready.
And I appreciate that. That was gonna be my second point, is the preparation. And I appreciate the opportunity for some shameless self-promotion. But the Respectability Law Center, we also have material available to parents. And our website is www.respectabilitylawcenter.com. So that's what's up there. We also have a Facebook page. Our Facebook page is also called Respectability Law Center. What our Facebook page does is it basically every day it lists articles and news items of importance to families that address all facets of life for people with disabilities and their supporters. So shameless self-promotion. Please feel free to go to both of those. But yes, the second thing is the involvement of your outside team as well. I think a lot of parents will say, I don't want to bother Dr. Johns, my kid's neurologist. But the truth is that Dr. Johns maybe wants to be involved. So don't be afraid to mention to your community providers, whoever they are, what's going on educationally for your child, and asking for their support. They may not be able to attend meetings with you, but they may be able to write letters that explain what a problem looks like from their perspective as a professional that's involved in the treatment. So don't be afraid to talk to your community treatment team, as we refer to them. So that's the second thing that I would say. The third thing that I would say is prepare yourself emotionally for every IEP team meeting, because there's a point at which you're going to want to be a parent, and there's a point at which you're going to need to be a team member. And if we cling too desperately to our role as a parent and look at it all as I'm fighting for my child, and this is me against them, that creates a difficult situation. That's the point at which our phone starts ringing. And that's the point at which it becomes necessary to try to sort through what's going on. So remember that you're a parent, but remember that you're also a full member of the team, and come with the attitude that you as a team member want to be have as much a right and as much knowledge and experience from your side of the table as anyone else sitting at the table. So What we sometimes do when we have really difficult cases is what we do is we start the IEP. We suggest, you know, all of us are here to see about what's going on. Jimmy, would you mind if we just got a quick picture of the team? And so, you know, you get everybody sitting in one corner, or, you know, standing up or whatever. And real quick, just take out your phone and take a picture of the team, you know, Johnny's team. And that will change the way that they look at, that sometimes will change the way the people at the other side of the table look at it.
Okay. Yeah, and really briefly, because we are running out of time, but can you just really quickly overview the different ways to address conflicts that they do arise? Hopefully you're not going to get to that point, but sometimes they do it.
If conflicts arise, they're easier to address under IDEA than they are under 504 because there's a standard format for it. In Michigan, if you don't like what a school district is doing, you can file a written complaint with the State of Michigan Department of Education, and they, along with the ISD, will process that complaint. You can ask for mediation. You can ask for a facilitated IEP, which means bring somebody from outside in so that they can help direct the discussion so that we're talking about needs and not talking about the issue of about the conflict itself. You end up talking about the needs and not what didn't happen the last time. There also is the right to file for and ask for a due process hearing, which is it's like a trial in front of an administrative law judge rather than a court judge. And it's contentious, it's costly. The school district starts out with $100,000 in their pocket when you ask for due process because their insurance policies pay for the first $100,000 of any due process hearing that they have. So you're also behind the barrel on money.
Hopefully don't have to get to that point. So another important factor that contributes to academic success is getting improved seizure control. So if you can improve your seizure control and get fewer side effects from your medications, then that's going to improve cognitive function and academic performance. And in order to get that, it's important to make sure that you're getting appropriate specialty care. And that's, again, we mentioned this earlier, that if you fail 2 appropriate medications and well-tolerated medications for your child's epilepsy, at that point you really need to see a pediatric epileptologist, preferably at a comprehensive epilepsy center. And we're very fortunate in this state in that we have several comprehensive epilepsy programs. We have Children's Hospital of Michigan, Beaumont Children's Hospital, University of Michigan C.S. Mott Children's Hospital, St. John Providence Health System, Henry Ford Health System, and Helen DeBastos Children's Hospital. And we even now have a pediatric epileptologist up in the UP too. So there are a lot of great resources. So that can be a really important component towards improving cognitive and academic success. Speaking of accessing that, this is a big state and there's a lot of rural, remote areas. Fortunately, there is a telemedicine program that is part of the Michigan Pediatric Epilepsy Project. Cindy, can you briefly talk about that telemedicine program?
Yes, it's through the state of Michigan, the Michigan Department of Health and Human Services. They got a grant, it started around 2006, and the purpose is to improve the health care and bring specialty care to rural and underserved areas, which we have a lot of. I just came back from the UP. And they want to hook up people, if they can't be there physically, at least through telemedicine, technical communication with the epileptologist. We have like 6 what we want to call hubs throughout areas. Some are in one's the Alcona Healthcare Center in Alpena, Sheboygan, Emmett County, and then up in the UP, Dickinson, in Iron Mountain, and partners in pediatric care in Saginaw. And they will see patients with epilepsy when they need the specialty care. They'll hook up with our specialists in Beaumont with Dr. Arndt, Children's Hospital, and DeVos. So whoever the insurance pays for, et cetera. And the primary will sit in at this external hub site, and then you'll have the telemedicine site at the specialty unit. So they'll be seeing both. So it's a good way of coordinating care, definitely.
And there is a map in your binder that kind of shows what the different sites are for that program. So if you have any other questions about that, let us know. And then Cindy, can you also talk about, you talk about advocacy in the healthcare system. Can you very quickly talk about care coordination? I know it's a much bigger topic than we have time for, but just talk about the medical home model and the idea of care coordination, what that involves.
Yeah, I'll just talk very briefly. It's a big concept, like you said, and it's changing back to what we used to do in the 40s as far as, you might want to say a little bit away from specialty care, but getting all your care in one area. It's more than just a building. It's a model for healthcare delivery, basically. And it has 7 qualities. It should be accessible, okay? And some say 24 hours, 7 days a week accessible, okay? Via phone, via technical, internet, whatever, somehow to get your answer. It's family-centered, meaning that the family is recognized and acknowledged as the specific caregiver and their input with their child in making decisions for that child in that healthcare delivery system. Continuous means you have a primary care clinician that's going to be responsible for the child from infancy all the way to transition, and a smooth transition into adulthood. And transition is another aspect we could spend an hour on.
Well, we will be spending an hour on that
Yeah.
right after this.
Right. It's comprehensive, which means it not only deals with preventable preventing, immunizations, those types of things, making sure your well visits are made, but also dealing with the other health issues that they have, and referral to specialty care. It's also coordinated. They have a plan of care for any of your healthcare needs. And they find out that the outcomes, it decreases the cost of kids going to emergency rooms and going to urgent care when you have all this. It's your home for medical care for that child. And it's a partnership, really. It's compassionate. These people should have a genuine concern for that child and that family, not only medically but psychosocially what's going on. And it's culturally efficient. But there's a lot of good qualities. If you look at, I wrote down the website, and hopefully I can find it here, but it talks about what the parent should expect and how the parent should be prepped for the meetings, as far as always bring a list of questions to each appointment, updated list of medications, diets, and supplements, anything that the child is on, list other health care providers and their contact numbers. Be honest and open and tell them what you don't understand. So there's a lot of things, and this was...
Right. And we can certainly, if you are at a point where you feel like your different the different members of your healthcare team are not communicating or coordinating your care effectively, certainly reach out to us and we can try and assist with that. So,
and one that's technologically up to date. That is essential to have a portal so that you are part of that coordinated care and have access to it 24/7.
Right. Okay, so we're going to open it up for questions now. So thank you very much, and we'll have about 10 minutes or so for questions.
Great. This is more to the neurological psychologist. How often would you want them to do the testing? So last year we did an 8-hour full-day neuropsychologist testing, but she's all over the board.
Mm-hmm.
And she's always changing because her seizures are always changing.
Mm-hmm.
So to get a bigger snapshot, what do you do?
Well, so generally we try to not repeat evaluations within a year, in part because there can be practice effects from having done a task, so performance can improve just by being familiar with it. Once we get to that year mark, we have enough time, distance in between that your child's not going to remember exactly how to do everything, and it will still be an accurate representation of what they can do. If your child's having very frequent seizures, if it's a more ever-changing sort of situation, then probably once a year would be an appropriate frequency. For for some kids, I see them every 3 years, you know, if their epilepsy is fairly stable. So it just kind of depends. And certainly communicating with your epileptologist and neurologist about, you know, whether this might be a signal of, hey, maybe there's something else going on and we need to change our treatment model. Sometimes that will be a reason to repeat. So if you feel like there's been a change, a decline in skills, that's often a big reason to repeat, because then that might mean that medications need to change or something else is going on. So.
I was going to say advancing the diagnostics and the change to a syndrome,
Right.
those types of things.
Super awesome information, because everything you said, like, keys into my family. So with this, now she's 17 and hasn't been to school. She's like, only has 3 credits, and this neuro testing, whatever, has never been done. And so they did a evaluation for an IEP and said, no, she didn't qualify for that. And her principal is the head of special education. And so now they're gearing me towards adult education. Now, with that, does that incorporate an IEP for adult ed? Because now she's 17 and a half, she has no credits, you know, basically. Well, what do we do? I mean, are there kids that fall in this?
First, in Michigan, special education services are available to a student until they graduate from high school or until age 26, whichever is later. So a school district has a continuing obligation to provide free appropriate public education and special education services to a non-high school graduated student with disabilities until age 26. Sounds like you need to call Cindy. Okay? Call Cindy.
Okay, thanks.
When you just said that, I just saw her light up a little.
This is what I came for.
Satisfied customer there.
Okay, I heard someone mention earlier about Khan Academy as an accommodation to help students, and I was just wondering if there's foundations that help for activities with children with epilepsy, with developmental disabilities. My daughter, we once received a flyer from her school, this was many years ago, for like a swimming program. It was offered in Wayne Westland, but they no longer offer that service. So now it's just like a general population swimming class that they offer instead of for special needs students or children. And I was just wondering, is there anything other than the ARC of Wayne County? Because I've been directed in that area, but I was just wondering, are there any other foundations for activities as far as being physically active for students or children with special needs?
Well, we definitely, if you haven't seen it already, we have our Camp Discovery program, which is a summer program. It's a 4 to 5 day, or 5 day, 4 night program. We have 24-hour medical staffing, and certainly one of the big responses we get on the evaluations is that the children are much more physically active at the camp than they were at home, and that kind of spreads to when they come back from home. The parents realize, hey, it's safe for my kid to be physically active. The child realizes they can do that safely, and it encourages them to get involved in other activities. But other resources that you're aware of?
I'm not aware of anything specific like that. I will point out though that the Khan Academy is a free website. Just, you know, I don't know if that was clear. I've had some kids that have gone through, that have done like the hippotherapy, which is horseback riding, you know, for children with special needs. I feel like there are others, they're not coming to me at the top of my head, but it's actually prompting me to think there has to be something like that. So,
there are other summer camps that are not condition specific, that are more just for special needs in general. So that would be another option. There's day camps that would probably be, you probably have to look at your local community. Maybe your school district would be aware of some specific ones.
Well,
Yes?
I would like to add one thing parenthetically to this though, and that is if you're talking about an opportunity that the district presents to students, as it originally sounds like it was for your child, if the school district offers services to the students as a whole, they must accommodate the needs of the kids with disabilities. They cannot be excluded because of their disability. They can't be excluded because dad or mom can't attend. They can't make having a parent attend be a condition of their participation. Our kids have an equal right as any other child to attend a district event. That whether it's to go to the beach or to go to a dance or or go to a factory, yeah.
Well, I mean, I understand that, but I was just saying as far as for them having the proper support, because, I mean, they may be inclusive, but, they may not have, they might not keep a close eye as the parent would for their individual child, because it could be, so many, as we were discussing, like having the students in the general ed classroom. I was just wondering if there was something more specific for those, children that, they have people that are continuously trained and everything.
If the issue is the student participating in school activities off campus, if there are identified needs, those needs should be included and addressed in the IEP or in the 504 plan. So there's no excuse for them not having a plan in place to be sure that your child is safe.
I know I live in Plymouth, and there is an organization out there that does like baseball groups for kids of all level of disability and that, and I can find out what that is because I've stopped by there and talked to them and given us their card and said, our children be welcome there, and they are. So that is.
We have one more question, and then move on.
I don't have a question. I just wanted to add to something we thought of. Our daughter just learned how to ride a two-wheel bike this summer through a camp called PEAC, or remember bikeprogram.org, if your child's having troubles, or they work with all sorts of kids there. It was amazing. They even had a child who was wheelchair bound. They put her in a chariot and went for our family bike ride last night. It was awesome.
Great. Thank you for the resource. Thank you.
All right, so we are going to transition to the next session, which is coincidentally about transition.